उसका आधार मिल जाता है। दूसरा, एग्रीकल्चर हमारे यहाँ प्रधानमंत्री बीमा फसल बीमा योजना है जी। फसल बीमा योजना ज़्यादातर किसान अपने उसका इंश्योरेंस नहीं करा पाते, लेकिन जो इंश्योरेंस कराते भी हैं उसको फायदा ज़्यादा इसलिए नहीं मिल पाता था कि हमारे पहाड़ों में जो मानक है वो यूनिट है तहसील जी। और इसमें बीमा का ये फायदा ये है कि तहसील में जब 30% का नुकसान, यूनिट में जब 30% का नुकसान होगा तब जाकर के वो बीमा का हकदार होगा। तो इस कारण, क्योंकि पहाड़ों में बहुत विशाल तहसील हैं, अगर 7-8 गांव पूरी तरह तहस नहस भी हो गए तो भी 30% नहीं बैठ पाता था।
ठीक है, तो ये
और क्योंकि हम पे मैन पावर नहीं थी, हमने पिछली बार इस डिस्पैरिटी को खत्म करने का प्रयास किया था कि हम उसको न्याय पंचायत पे ले आए कि मानक हमारा यूनिट न्याय पंचायत हो जाएगी तो संभवतः कुछ ज्यादा फायदा किसान को मिल जाए। लेकिन मुझे खुशी है कि इस बार हमने एक नया इनोवेटिव लिया है। हम इस बार सारी की सारी एग्रीकल्चर जो क्रॉप कटिंग है जी, बिल्कुल, इस क्रॉप कटिंग डाटा को हम आउटसोर्स करने जा रहे हैं।
अच्छा, तो इससे भी किसानों को फायदा मिल जाएगा।
बजट का प्रावधान हो गया।
हाँ जी।
और क्रॉप कटिंग डाटा जब हम इसको आउटसोर्स कर देंगे तो हम पे ग्राम पंचायत वाइज डाटा रहेगा।
चलिए ठीक है, अब हमारे प्रोग्राम
को बहुत महत्वपूर्ण बता रहा हूँ मैं, जो आपने कहा। और हम चाह रहे हैं कि हम ग्राम पंचायत को यूनिट बना दें ताकि किसी भी ग्राम सभा में नुकसान होगा तो उसको
ग्राम पंचायत के जरिए आसानी से ट्रेस किया जा सकेगा।
ये जल्दी उसको इंश्योरेंस मिल जाएगा। 30% अगर ग्राम सभा में हो गया तो उस ग्राम सभा के लोगों को मिल जाएगा।
बिल्कुल, ये बहुत अच्छा कदम है आपका। और बहुत सारे लोगों ने, बहुत सारे किसानों ने अपनी अपनी समस्याएं बताई हैं, तो मुझे उम्मीद है कि आप जरूर उन समस्याओं को दूर करेंगे और आप हमारे कार्यक्रम में शामिल हुए, इसके लिए आपका बहुत बहुत शुक्रिया। तो कोरोना के इस मुश्किल समय में हर किसी के हिस्से में थोड़ी थोड़ी तकलीफ आई है और कुछ कुछ सबक भी मिले हैं। तो ये जो समय है वो मिलकर इस कोरोना से जंग लड़ने का है, जिसमें किसानों की भी अपनी भूमिका है। तो कार्यक्रम में इतना ही। नमस्कार।
Rating points is 34 points behind Smith. 900.
Namaskar, welcome to Dr. Speak. India is in a lockdown till the 3rd of May and it is showing good results. The rate at which the virus is spreading has slowed down considerably. It is doubling now in more than 6 days. The method under lockdown is a process of firefighting, in a sense, isolating pockets where the virus is and then taking strict measures to arrest its spread. So this is the most appropriate way of dealing with the threat of the coronavirus outbreak at the moment. And all of us have to play our part in this. This program puts you in direct touch with specialists and experts. Knowledge about the virus is developing every day. But in the midst of all that information, there is an equal amount of misinformation. So this is the time to get your doubts cleared. For the next 1 hour, our medical experts will be answering your questions. Our numbers are on your screens as I speak. 011-233-87031 and 011-2309-7655. Our lines are open now for 1 hour between 2 and 3 p.m. You can call us and ask your questions. Your questions, in fact, could help clear many doubts about coronavirus. It will also help disseminate the best practices to counter its spread. So please do ask your questions. Let me introduce you to our guests today. We have with us Dr. Tanmay Talukdar, the HOD of Respiratory Medicine at Lady Hardinge Medical College. Professor Ashutosh Biswas from the Department of Medicine, Professor at Department of Medicine at the All India Institute of Medical Sciences. And Dr. Ashok Kumar is Associate Professor of ILBS, which is Liver and Bile Institute. So thank you very much, doctors, for being with us. Let me start with you, Dr. Biswas. We have been getting some questions. There's a lot of backlog, actually, because there are questions coming in on the internet, which we've not been looking at, from email. So one of the questions on email that has been received is this. Stomach pain, loss of taste, sense of smell, dark-colored patches on legs, brain inflammation and stroke. Are these signs of COVID?
Yeah, usually the signs to identify the COVID patients are not this, because fever is the most important. Fever, cough, and your body ache. Generally, there will be also sore throat. So
this particular question has quoted some newspaper reports saying that this has happened. This is basically.
So these are the common symptoms.
Yes.
But any patients, we expect some symptoms are very rare symptoms. So these are all the rashes and also pain abdomen and stroke. There are few cases are reported, but we have to understand that when this patient, what are the comorbid conditions, whether this patient are diabetic, hypertension or anything else or not. And this may be of the few cases, because this is a viral infection.
Yes.
And depends on the complications are dependent on the severity of the disease. So the stroke is a severe kind of manifestation of this disease, and also rashes are something. This can be a viral infection in any other cases also, dengue like other chikungunya. We also get some infections, skin rashes in these cases. So, and pain abdomen, vomiting, these are also part of the infection can have, but these are not a very definitive and identifying features or symptoms of this disease. So this can happen very rarely.
Dr. Talibdar, would you like to add on this? Because Dr. Biswas has already spoken about rashes, but you know the next question was also about rashes. Rashes on the legs, are these also signs? Because this is quoting, in fact, a newspaper article in which this was written about, so people are a little concerned.
See, I would like to stress on what is most commonly found. And the three major symptoms has been the fever with cough, which is usually dry, may be productive occasionally, along with breathlessness. These are the three hallmark presentations which is there. But now, since we are having hotspots, so those who have influenza-like illness is also being considered in those localized area where the clusters are, and so hence we should know what are these influenza-like illnesses and its symptoms. So that could be upper respiratory issues also. So throat irritation, repeated cough and cold, sneezing, malaise, body ache. So all the features which is there in influenza-like illness, they also would be considered to be evaluated subsequently. It could be clinical evaluation and also with the test, depending on the test which is being done there. As far as the other symptoms which you talked about are very rare. In fact, even diarrhea has been reported in some patients as one of the symptoms. But then here I would finally and firmly stress that a large chunk of patients would be asymptomatic. So let's not only depend on based on symptoms. A large chunk of people may be asymptomatic or have very mild symptoms, and hence the protocol of social distancing is mandatory.
So Dr. Kumar, you can talk about that. Asymptomatic patients, why are they asymptomatic? I mean, do they have some higher immunity or what? They don't even feel the virus, and then they are carriers of the virus? You know, I mean, we know that this virus comes from bats, and the bats themselves are not actually, they are not infected by the virus. They are immune to it in a sense. So, I mean, have humans also developed some kind of immunity?
Yeah. So first we coming to asymptomatic. I think in fact that is the most common presentations for the COVID. And except the fever, cough, and what you're telling, respiratory shortness, that is a seminal part of things which is symptomatic. And asymptomatic, we cannot detect in many of cases. This is obviously related to immunity. You can see those symptoms are more with those having comorbidity like diabetes, blood pressure, liver, cancer, or on any immunosuppression medications, because their immunity is down. And when you consider the age, more 60 above, they are more symptomatic because the immunity has to go down. And third, in any disease, it is a part. There some person will have symptoms, some person will not have symptoms. And that's why asymptomatics are a major chunk. And the last you...
No, actually we are getting a caller in, so I don't want them to, you know, go get off the line. We have Sandeep Saxena who is calling us with your question. Sandeep ji, aap apna sawal puchiye.
Good afternoon, sir.
Good afternoon.
I would ask any of the doctors on your panel, could they please tell us if there is a general prescription which a person can use if he has a normal cough congestion? Because people who do not fear corona, if they, even if they have a simple cough or cold, they doubt it. But if they have no factor to be worried about corona, like they have been properly maintaining all the hygiene and all the terms and conditions, and they have been locked up in their house pretty before the lockdown was imposed by the government. So they are very sure. But if they have a simple cough congestion, for example, I have a lot of cough congestion in my chest. I can feel the cough. So instead of going to the doctor, could it be generally prescribed what we can do at home to deal with this coughing?
Okay, Dr. Talukdar, since you're a respiratory medicine expert, you can help us with that, sir.
Yes, see, what is important is that just based on the symptoms, we don't make diagnosis of COVID. So there is a few criteria which make somebody a suspect of COVID, and it is now well known that if we have come in contact or likely contact with somebody who is a confirmed case of COVID, or if we are in a profession which makes us at high risk, for example, a symptomatic healthcare worker, or most importantly would be if we have been coming in contact with a known case in our house, even if we are asymptomatic, or we are a healthcare worker who has not been wearing the appropriate protective measures. So these are the few issues which we have to be careful about. Apart from that, the travel, last 14 days travel, but then fortunately we have not been traveling because of the lockdown. Otherwise, a symptomatic traveler, international traveler in last 14 days. So people having symptoms of cough who come into this category has to definitely get in touch with the healthcare worker. So here I would like to make a distinction. If you come into any one of these, if you're in a hotspot zone, or if you've been in contact with a suspected or confirmed case of COVID, then definitely you get in touch with the healthcare professional, or better still take the toll-free number 1075. Apart from that, if you have mild symptoms of cough, whatever treatment medication has been given to you by your prescribing physician, before you said you are having problems for quite some time. So whatever syrups or whatever medication has been given to you, because it's a long duration of cough, so most probably you have allergies. It's very difficult to make a diagnosis on this small history, but yes, if it's a mild symptom, definitely you can continue the treatment which is being prescribed by your physician. But here I'd like to stress on one important thing. Other services which are emergency, or if there is mandatory requirement to go to hospital, please do go to hospital, because other services are also being provided. It's not that antenatal care is not there, or immunization, or a sick child. Hospitals are taking care of them as well.
Absolutely. So the other, I mean, people who have other illnesses are also needing to go to the hospital. They should go. The hospitals have not closed down for other things as well. Let's take a question that has come by on Twitter. The question is to Dr. Ashutosh Biswas. How many months will we have to maintain social distance? And they ask now if bats can be carriers of this virus, so can other animals, is the fear. And you know, we've also got cases where cats, I mean, the big cats have got the virus. So small cats can also get the virus? And can they transmit it?
Yeah, this is a zoonotic disease, and primarily it has been seen the carriers are the bats, and mostly it has been also hypothesized that probably these are all in Wuhan, probably these are animal market and switched over from animal to the human being. So now it is not important to think that whether it is a now zoonotic, that it is now transmitting in the human. So human to human transmission is going on. This link and the human transmission link already established. So it requires the switch from animal zoonotic to the human, and when it is circulated, now it is the most important is. The question is from the human to now transferring to the animal or not, that we
from the animal to the human as well.
Animal to the human. So it is already transmitted from animal to the human.
I'm talking about animals like your pets.
Now pets and that, yes. If these animals are, if you are coming in contact, there may be a few cases that the dogs are infected already, and now there is a from dog to human. This is not yet been confirmed. But yes, in dog, some animal now it has been seen that they are infected. But from this, and they are likely to be, if it is a zoonotic disease, and if you are in contact with the human and coming in very close contact, probably there is a chance of transmission from the animal to the human. So always there is.
We have a caller. Samir is calling in from Delhi. Samir, आप अपना सवाल पूछिए.
सर, मेरा क्वेश्चन डॉक्टर आशुतोष से है.
जी.
डॉक्टर आशुतोष, सर आप बताएंगे जो एजेड लोग हैं उनको क्या प्रिकॉशंस लेनी चाहिए इस समय में? Thank you.
Can you ask your question again, please?
Disease. Yes, my question is, Samir from Delhi. My question is, the aged people, the people who are in old age, what precautions they should take?
एजेड पीपल के
In
लिए
current
एजेड
situation?
ओके
एल्डरली के लिए
elderly people, देखिए elderly people are very much vulnerable. As we have seen, the lot of people aged more than 55, 60 years old, they are likely to have this infection and easily transmitted, because the first is the immunity is the one factor. So probably elderly, when we are aging, the immunity goes down. That is one important factor. At the same time, we have the lot of comorbidities that coming into this aged people. So like hypertension, diabetic, obesity, coronary artery disease, kidney disease. So these are all is one of the important also risk factors of. So when somebody,
what if they don't have all this?
So
what if they don't have it and they are still old? So
yes, if they don't have anything, so naturally they are like other people, but still aging is the one. So you have to maintain. The question is that whether at home we are mixing with a lot of people, younger and the older people, whether the older people should maintain a home distancing or not. We talk about the social distancing, where in the society we go for the market, in the public places we maintain the social distance. So whether they should maintain really, so this is one question. So probably one important thing that if any one of the member is exposed to outside, going outside and coming in, so definitely the older people should not interact with that person, because he is already at risk. So you have to be very careful. If the people, those who are staying at home, they can mix with, but person who is going out and other all hygienic maintenance, that should be eating healthy, exercise, those things are really giving some times that make your health fit. So otherwise I think maintaining the all comorbidities condition, maintaining the drugs and management.
I think generally, maybe Dr. Kumar can also help us. There are elderly people, I mean, there's a presumption that one has to take care of them and because of age, but some are very healthy and they may want to actually, live a normal life. Are we giving them too many restrictions?
Yeah, now restriction is needed for everybody. First of all, the social distancing is not, as far as age is any limit or any bar. So elderly peoples, they may be healthy, they may not have any comorbidities, but when you have symptoms, then they may have a protracted course. That means they may have more prone to develop severe ailments, because physical healthy and the body system healthy. Body system means you see the immune system or your body homeostasis mechanism, what is the defense mechanism, that may not go as per his health. So obviously, if a elderly person is little bit diseased or frail, then they are more risk. And those who are having healthy, robust, doing activities, fun, play, they may be at less risk. But we should make the restrictions. It is a norm and it should be followed.
Dr. Talukdar, the next question is about confusion at hospitals. I don't know whether you can answer this, but some doctors say that we must first watch out for symptoms. If you have a mild cough or a fever, and then no need to visit a doctor, as there is already a massive crowd at hospitals and doctors are under heavy workload. But some doctors say that if you should immediately seek doctor's consultation if any of the aforesaid symptoms occur. So this is very confusing to some people. They want to know whether, okay, I have a cold and a cough. What should I do now? I mean, some doctors say stay at home, you're okay. Some say go and consult a doctor.
See, still we're in the change of season. So upper respiratory issues, cough, cold, mild sneezings, and all these issues would happen in this season. So just because we have these symptoms, we need not rush to the hospital. At that point, I'll agree with the thinking which is there. But then, if we have the hallmark features of high-grade fever with breathlessness, with cough, or having had contact with people who are likely to be COVID, then definitely we should get ourselves evaluated by the doctor. Here I am being very specific, evaluated, not tested. That decision is with the doctor. But then how do we do that? We need not rush to the hospital at one point. We can definitely take appointment. The toll-free numbers are easily available, and the national toll-free number is 1075. It would guide us to which is our nearest hospital, where it is easily available, where COVID screening can be done, and then the patient and one attendant should go. We should not crowd the hospital. More importantly, all symptomatics should follow the basic hand hygiene procedures and also put on a mask when he or she is going to the hospital, the patient also and the attendant also. So that is what is important, and there is no confusion at all. If there is any doubt, just use the toll-free number or the helpline number. Here, I would also like to add one point to the previous question where the elderly people, because we all have elderly in our household, even I have elderly parents staying with me. Here, I would like to stress on the fact that yes, the elderly people may be healthy, but what has been seen in many countries, especially China, is that the disease may be affecting everybody, but the severity of the disease, what we say bad morbidity and even death, mortality is more in the elderly patients. So it is imperative for all of us that we protect all our elderly. Even if they're absolutely healthy, they can carry on doing their activities, exercises at home, read newspapers, digital newspapers,
so
stay mentally fit also.
Point.
But we have to protect them because the morbidity, that is the bad disease as well as death, is more in elderly people.
And that we saw in Italy, in fact, that much of the cases there were actually elderly people. Aap kuch bolna chahte hain?
Yeah, in continuation to Dr. Talukdar, the common cold, the confusion. You see, the coronavirus is a stage of the viruses which routinely cause flu or symptoms to us.
Okay.
So previously, when there is no corona epidemic, we are using most of the times self-treatment. I know everybody knows the home remedies are continuing, because this is a variety where you are going to have a massive outbreak in hotspot areas where these symptoms may not be ignored. But you have to remember that 80% of symptoms get cleared by its own. So, and if you move out of for the testing or for the hospital visit, that causes another source of infection. You may not have a COVID, common cold or viral infection, you may acquire it when you are going outside. So that's why it is been of the WHO and also most of the government authority guidelines that if you have symptoms, don't rush to the hospital, just have a toll-free number.
We have a caller online. Shrestha from Delhi is calling in. Shrestha, aap apna sawal puchiye.
Hello, I'm from New Delhi. Just saying, my question is related to the groceries that we buy daily. It's practically possible to wash, to keep them for long because they will rot easily. So what can we do to prevent getting corona from the vendors who are locally selling those groceries in our area?
So I think the question is about vegetables, washing them. I think, you know, this is a question that has been asked several times, but there is confusion. You get the vegetables from different sources. How basically should you be dealing with it? Dr. Biswas, would you like to answer?
Yeah, no, vegetables, now we are going into market and buying a lot of things, not only vegetables. So but usually the vegetables, now when we are bringing and buying, what is the risk? Because when we cough and we sneeze, the droplets which are tagged with the viruses may also fall on this. So this is the how we are thinking of this. Could contact somebody, and if we touch on that, probably that can, the droplet and the virus can go into our face and nose, and then we breathe in and then we are infected. That is the process that how. So if you want to, we are buying these vegetables, one is that we should wash properly. By washing, that virus may be washed out. And so also sometimes if you keep this for a few hours, maybe 2 to 3 hours outside, and then this may be also viruses are seen that 2 to 3 hours on the surface and may also die. And also we could use this salt water for washing them. So these are the process through which that no virus could be cleared up.
Fair enough. So they have to be washed, and preferably with salt water. That is the advice from the doctors here. This period of lockdown, Dr. Talukdar, it's also preventing a lot of other respiratory illnesses from spreading, isn't it? So this is a good time, in a sense, to curb a number of other diseases that are spreading at this time. What would you say?
As a respiratory physician, what makes me happy, it's a like silver cloud with the silver lining, is that people are now getting aware of what is respiratory etiquette and cough hygiene.
Yes.
So many of these respiratory diseases which we have, especially tuberculosis, because tuberculosis is a high burden disease in the country. So if everybody understands the idea of cough hygiene, that is not to cough straight into the hand or in the open, but to cough in the sleeves of our hand or use a tissue which is disposed of. So with this, we'll be able to prevent many other such disease. Health awareness is coming up now. People are getting more aware of their health. People are thinking about yoga, meditation, healthy food, preventive food. The question about prophylaxis is coming up. What food we should take to prevent ourselves from having disease, and hence people are searching out information out there. So all this would definitely make our community and the society as well as country more healthy. That's what I believe.
Dr. Kumar, you would, this is something that you would be willing to talk about, I presume, yes?
Yeah, I think I just complete with the restriction, pulmonary disease, particularly bronchial asthma.
Yes.
So that is, I think in Delhi, it is a bigger burden. I think that may have come down, Dr. Talukdar.
Especially because of the pollution level going down, because if you look at the air quality index, it has gone down, and many asthmatics during this change of season have this trigger due to pollution, and yes, definitely that number of people have come down.
In actual respiratory disease, as a gastroenterologist or a hepatologist, I can say the liver related diseases like hepatitis also because of the water contamination. Diarrheal episodes also. There are a lot of hospital visits has come down because of this illness. And another important that the non-essential hospital visits in absence of symptoms has drastically gone down also. That makes more people to be feeling that they are healthy.
So this raises an important point, because now people are aware of trying to live a better or more healthy lifestyle. One has to consolidate on this and try and sustain it for however long. That will create a healthy country, isn't it? Dr. Kumar, what kind of advice would you like to give people to try and maintain a healthy lifestyle, because now they are getting into the habit of it?
So interesting thing that health is not absence of disease. You have to remember, health is a composite endpoint for physical, mental, social and spiritual well-being. So what we think of that we have been suffering from illness, we are going to hospital, that is the disease, that is a physical component of the health. But when now we think that we should have a peaceful life as far as mental condition is concerned, social interaction has been concerned, and that has now taken a big way. And third, you can think of that now we are becoming more self-dependent or upon us for activities. That's another good point, that we can do a lot of self things. And now see, the spiritual things also has got a better benefit. I think we are sitting in the DD, and I know I heard that the Ramayana has highest TRP in the country. So you see, the spiritual health is coming off, social well-being is coming off, and also psychological mental part, some component because of the lockdown. But when this lockdown is over, but people know what is the meaning of the family. This is the first time that we are being for a long period with our family to enjoy happy family life in addition to the health. So definitely this health component is now understood by lot of us that it is a holistic approach, not a disease and law.
Fine. And a question has come which is related to this in some way, because it says that, you know, we can do everything we can to maintain ourselves and keep ourselves free from COVID. But then when the airlines open and then somebody comes and then the whole process starts again. So what's the whole point is the question. Dr. Biswas, maybe you can answer that.
And so after lockdown is over, lifted, so naturally there will be again, we'll be back to the normal life. Now, with this, I think this lockdown has taught us how to live. Now, it is totally changed our style of living and everything. I find that we learned many things from this, outbreak. So when we'll go back to this society and using this all going, so there will be initially, I find there will be chaos because everybody is locked down at the distance when everybody is at distance. So after lifting, the transport system will be, I think, overthrown with this all crowded place, and this all transport system will be crowded and overcrowded basically, and then everywhere it is. So this is one point. So at this moment, in terms of lockdown and the releasing the lockdown later on, so there will be expected that another curve may come up. So it has been seen in different other countries also. There may be the second wave, because this lockdown when will be totally relieved. So there is a chances of, because now we have seen the second phase of lockdown. See, last 4 days it has gone up almost 3,000 cases added to that. So totally it is more than 14,000 cases, till now. And when this lockdown started, we had only 550 cases. And this all 14,000 cases are evolved or got positivity during this lockdown period of 3 weeks. So where from these cases come? If everybody is at home and totally locked down, so how these 14,000 cases coming from? So it is really, we have to imagine, closely examine that then there is some leak in the system of the lockdown. So how this is where we are missing really is if it is right time that really our Prime Minister has started the lockdown at the point 550 cases. Now you imagine if it would not have been imposed this 14,000 instead of this, probably maybe in lakhs and lakhs cases coming. So there will be chances again if you go back to society, overcrowding slightly, though we have to go by phase wise. It's not that really we jump onto the all system. It is already in place. I think maybe already government has decided on 20th.
We have a caller online. Ruhan is calling in from Delhi. Ruhan, आप अपना सवाल पूछिए.
Hello. Yes, my name is Ruhan Satika. My question is, do people, if we saw Dr. Ashutosh, my question is to Dr. Ashutosh, do people under 15 have more immunity to coronavirus, or is this just a rumor?
Your volume was a little soft. Maybe you can repeat your question, Ruhan.
Yes. So, do people under 15 have more immunity to the coronavirus, or is this just a rumor?
Still, Rohan,
I think she was saying is that after you get this illness and you
can you help your other person to speak it? Your mom or dad is there to speak clearly about the questions.
Yeah, it's something about immunity. She was talking about immunity. You develop an immunity to this virus after you get it, and how long does that last?
Okay. So no, this we are not sure about that. Once this virus, if somebody is infected, whether it will give the lifelong immunity or is the partial immunity. It has been seen in few publications, and in the China also there is second time infections are there. So this antibody which is developed in the first infection, whether they are really very much neutralizing, how much neutralizing, that is yet to evolve it. So this is second, because it also depends on the subtypes. No, there are A, B and C. So depending on which types that you are infected and and then if you are infected with the second B types, though there are many things into it. So it is still, if there are cases reported second time infection, so probably it is not giving a lifelong immunity. So you are not protected for long. So you are still, there are chances of getting infection. So you
that will have an impact on the vaccine that also we are creating, isn't it? If we because we're utilizing antibodies that would come from a cured person to try and create a vaccine. And if the person can be reinfected, that means the vaccine may not be as.
So, but here one point of happiness for Ruhan is that the SARS, this is corona is called as SARS-CoV-2.
Yeah.
So when go to the SARS virus, which has come in 2002, but after 18 years also we not found yet it has come again. So we don't know it is because of the antibody produced for this virus or because it's not there. So be positive that it is unlikely to come up. Okay. That should be food for thought.
Right, Dr. Talukdar, there is a question that has come in on Twitter which says that why don't we just walk into kiosks and get ourselves tested? That would be much faster than all this entire process. What would you say?
Yeah, I would definitely answer that question, but I'd like to clear the air first, Mark, with your permission.
Sure.
Regarding the benefits of lockdown, it's imperative that our viewers understand that. See, what has been the mathematical projection have been shown that had we not had containment or lockdown, the number of cases could have been as high as 8 lakhs compared to what it is today. Similarly, after the lockdown, the growth factor has come down significantly. The cases numbers are in absolute terms are increasing, but the rate at which it is growing is definitely far less than what is in other countries and what was before. So that is very, very important. We have to remember, and obviously you began the program by reminding us about the doubling time, which has come up to 6 days now, and more than 6 days in fact, which is definitely a very good indicator. Most importantly, please do compare the number of cases per million in India compared to certain countries in Europe and America over the same period of time. So definitely lockdown has helped, and after lockdown definitely we have been preparing over the period of time. This lockdown, the entire apparatus has been getting ready if at all number of cases spike. So that has been the advantage of lockdown, and the most important advantage of this time has been the behavior change. Now we are all aware of what we have to do to prevent the spread of this disease, to bring down the chain of transmission. Now most people in the country know how we have to save ourselves from this disease. Now,
with regard to testing, well, I mean, also since you were talking about the lockdown and testing, you know, there was an impression that we are not testing enough, but we see that, you know, we find for every 24 tests, a few days ago, that was the data, we find one positive case. That means we are really testing in quite a large number. But this gentleman suggests that, you know, we just walk into a kiosk and test.
See, in India, we have very clear-cut test criteria, and it has been a graded response. As the disease has progressed, the test criteria has been very robustly changing. So it is not test on demand in India, that I feel like getting tested today, I walk in and get myself tested. The criteria is very clear, and we have already talked about it. So we have to have confidence in the fact that we began with one lab in the month of January, if I'm not, I hope I'm correct about that. It was January, we had one lab, now more than 188, even a little more than that, of ICMR labs. And apart from that, the private setup has come in. They have their setup, and they have their collection centers also. So if your doctor advises you the test, it is better to have appointment from these private centers if you want, because they would do home collection of the test. So that is even more safer to get it done. As far as your kiosk is possible, yes, where the test is being done, a kiosk can be set up, but then whoever and whatever is the process, we have to be very careful about wearing the personal protective equipment. It is imperative that the centers where these testing, sampling is being done, the doctor and the person who is doing this, taking the sample, has to be in full protective gear. It is very, very important there.
But here I will just tell you, kiosk model is basically
provided that they take all the precautions.
What is the benefits? Because this kiosk model has come from the Korea.
Yes.
The Korea has able to control this COVID because of mass testing. They done testing for everybody, and that is why this help of the kiosk. In crowded places, they put a kiosk. The person who is testing, he remain in a closed chamber with all PPEs. The person who is going there, he will just come here, and they will collect the swab and from the nose and mouth. So that is a very much promising thing. But for that, our system should be ready, and its implications should be well known. So that is why it is not practiced here. But obviously, if it happens when we are going for the random test for everybody with irrespective of the symptoms, but that is depends on the policy makers and the epidemiological issue, so which is very difficult to discuss in this program.
Right, fair enough. So we're getting a lot of questions, and so let's move on. In fact, Rahul is on the phone line. Rahul, can you ask your question, please?
Yes, sir. My question is that what kind of food is more profit for us to combat COVID-19?
Rahul, I think we are still not very clear with your audio. Could you repeat your question slowly, please?
What kind of food is tremendous? Hello?
Yes, sir, Rahul. Rahul, yeah, go ahead.
What kind of food is better to combat COVID-19?
Not clear yet.
The sound, we seem to have a technical problem with our phones today, I'm afraid. But anyway, Rahul, we are also available on Twitter and on Facebook. You can type in your question, and we'll, it'll come to me over here, and I can ask it. You can ask that way too. But Dr. Biswas, there is a question that has come in, and this is a pertinent question about a lady who has a 3-month-old baby, and she says that apparently they've stopped the vaccination program as a result of this lockdown, and she's a bit confused and she doesn't know what to do. She said her baby was due for one vaccination, OPV2 and pentavalent 2, and this is stopped. What would you say?
No, so if the baby is healthy, I think he should not be, or the baby should not be deprived of the routine vaccination program. because there is nothing like that. If somebody
it says the government vaccination program is stopped. That's what she says. I do not know whether this is true or not.
No,
it's not true.
I don't think it is true. But this all routine vaccination, there are centers. The hospital is working, and there are maybe one wherever she is living. Maybe that center is, I think, closed. But it is as a government policy. It is still running, and our hospital is already working many places. This is emergency services, and this should be maybe few days plus minus. But yes, this program cannot be stopped, because this is a very timely period. The vaccination is very important for the future protection.
And you know, people have been discussing about the vaccination program and whether it has built some sort of immunity against, because you know there is a massive type of number of viruses that we have in our society, and maybe Dr. Kumar, you can tell us a little bit about our immunization program. How protective is it against you know, the kind of viruses that are available around?
Yeah, the virus, I think what you know, there's a lot of viral diseases and there is a lot spectrum of vaccines. But what we can discuss here, I think Dr. Talukdar is here for the influenza vaccine, and it is very much recommended for all those having more than 60, I think, or those having any comorbid disease. Those are immunocompromised and to be given. And I think in India we are as a optional thing, but if you go to the Western setting, it is compulsory that you should get a vaccination for the flu, and it is to be given yearly once. So that is why one viral vaccine is available, and this even also particularly for confined to the flu also, but it helps in preventing other viral infections. If they are developing, the severity also calm down. So in that way, and other viruses we are not going to discuss, like you think of hepatitis for the liver, we have papilloma virus for the cervical or cancers is there. So there is a lot of bundle of viruses, vaccines, and it varies from age group as well as male, female, gender wise.
Right. Dr. Talukdar, you know, when we are exposed to a number of viruses, and many of us have sort of developed immunity, we built some antibodies. Do those now, when you know, when you're looking for solutions to this particular virus, do some of those antibodies also act, you know, as defense mechanisms for this virus as well? I mean, why are people asymptomatic is one of the questions I'm trying to figure out as well.
That's an interesting question. You are asking whether immunity to other viral respiratory disease would give us immunity to this COVID-19 virus. Now, see, this is a new virus. Our body is not used to this. This came from zoonotic, from the animals to human being just 4 months back, 3.5, 4 months back. So yes, our body does not have immunity to it. Some of us have a better innate immunity. Innate immunity is the immunity which is inherent among us to protect ourselves from all the foreign body, be it bacteria, virus, protozoa, or other agents. So that is where obviously some of us is doing better. Some of us are, even if they are getting symptomatic or getting the disease, are not expressing severe symptoms. But as far as the vaccine for this disease is concerned, let me clarify, there is no confirmed vaccine at the moment. There are more than 40 candidate vaccines which is there, but please remember, vaccines take a little time to come up, matter of months, most possibly 1 year, more than 1 year. Right. So, you know, first you have to have a candidate vaccine, then you have a clinical trials. We got to find out whether they are safe or not, and then finally we find out how effective or efficacious it is. So COVID-19 vaccine is a little far away at the moment, and hence, as I keep always saying, prevention is the best policy.
Right. We have a caller, Gopal, calling in from Assam. I hope the line is clear. Gopal, please ask your question.
नमस्ते सर।
नमस्ते।
सर
पूछिए।
मेरा सवाल दो है। पहला सवाल ये है कि सर ऐसा देखा गया है कि अगर कोई डायबिटीज या और किसी बीमारी से ग्रसित जो पेशेंट जब भर्ती होता है और वो कोविड से मर जाता है तो उसको कोविड में काउंट नहीं किया जाता है कि वो कोविड से मरा है। तो मेरा पहला प्रश्न ये है कि WHO से या किसी दूसरे संस्था में कोई स्टैंडर्ड ऑपरेटिंग प्रोसीड्योर है क्या, जिससे जो आप लोग मान रहे हैं, जो हमारे इंडिया के डॉक्टर्स मान रहे हैं किसी को मृत घोषित करने के पहले? ये पहला सवाल है। और दूसरा सवाल है कि जो कोविड पेशेंट के साथ जो डॉक्टर्स डील करते हैं वो किस फील्ड में स्पेशलाइज करते हैं, कि मतलब किसी भी डॉक्टर्स को हम लोग यूज कर रहे हैं कोविड पेशेंट्स को ट्रीट करने के लिए, या कोई स्पेशलाइज्ड फील्ड के डॉक्टर्स को हम लोग यूज कर रहे हैं? ये मेरा दो सवाल है।
डॉक्टर विश्वास, आप
देखिए, इसमें कोई भी डॉक्टर ये कोविड में जाके ट्रीटमेंट नहीं कर सकते, बिकॉज ये स्पेशल थोड़ा सा डिजीज है, सिम्टम्स, एंड इसमें आपको नॉलेज होनी चाहिए कि हाउ टू प्रोटेक्ट योर सेल्फ। एक तो पहले पीपी के बारे में जानना होगा, ट्रेनिंग देते हैं हम, और सेकंड कि पेशेंट सिम्टम्स किस टाइप का सिम्टम्स है। तो इसमें देखा गया रेस्पिरेटरी सिम्टम्स अगर ज़्यादा है, पेशेंट वेंटिलेटर पे है, किस टाइप का है। अगर वेंटिलेटर पे है तो क्रिटिकल केयर मेडिसिन जो स्पेशलिस्ट है वो मैनेज करते हैं। अगर पेशेंट डायबिटिक है, कुछ ज़्यादा सिम्टम्स नहीं है, सपोज बेड पे है, तो हम उसको जैसे इंसुलिन पे है, एंटी डायबिटिक मेडिसिन ले रहे हैं तो उसको हम रेगुलेट करते हैं। क्या होता है कि जो डायबिटिक पेशेंट है उसको अगर कुछ भी इन्फेक्शन हो जाता है, कोई भी बैक्टीरिया वायरल इन्फेक्शन, तो जो रिक्वायरमेंट है इंसुलिन की और जो भी ओरल डायबिटिक एंटी डायबिटिक ड्रग्स में है, सो वो ब्लड शुगर कंट्रोल में नहीं होते। सो उसमें क्या करना होता है कि इंसुलिन में फिर डालना होता है, फिर इंसुलिन रेगुलेट करके उसको मैनेजमेंट करना होता है। सो इट इज ए स्पेसिफिक मैनेजमेंट रिक्वायरमेंट है, ये नहीं कि कोई भी डॉक्टर जाके कोई भी पेशेंट वो देख ले। और दूसरी एक क्वेश्चन है आपका, जो डायबिटिक पेशेंट अगर वो मर जाते हैं और कोरोना है तो उसको डायबिटिक माना जाता है, डेथ सर्टिफिकेट कोरोना डिक्लेयर नहीं करते, ऐसा नहीं है। उसमें भी हम कोरोना इन्फेक्शन वो भी लिखते हैं, और उसमें कॉज ऑफ इमीडिएट कॉज ऑफ डेथ हो सकते हैं कि डायबिटिक का कुछ कॉम्प्लिकेशन हो, कार्डियक प्रॉब्लम हो, किडनी प्रॉब्लम हो, इस टाइप का कुछ होते हैं। तो वो भी साथ साथ कोविड प्लस डायबिटिक या हाइपरटेंशन हो, कोरोनरी आर्टरी डिजीज हो, वो भी लिखा जाता है। तो ये ऐसा नहीं कि हम कोरोना अगर पॉजिटिव
दिस इज द स्टैंडर्ड प्रैक्टिस।
यस, ये स्टैंडर्ड प्रैक्टिस है
जी। सो दैट्स एन इम्पोर्टेंट पॉइंट दैट्स कम क्लियरली आउट। डॉक्टर Kumar, let's understand more about our own systems that have been prevailing, let's say grandmother's tales in a sense in our country about how to protect yourself from viruses or from colds. And I think the Ayush Ministry too has now brought out a number of things. One of them is also drinking herbal teas. Tell us a little bit on how these are actually protecting us.
So basically speaking, it will be out of my track, but I think now we need a holistic approach, and for that, first is that, as we know that this virus most likely remains the upper respiratory tract, so that's why you taking frequent hot sips. It can be lukewarm water, it can be herbal tea or green tea, coffee frequently, doing gargling, and now they are using some youth milk and haldi. So there are a lot of naturopathy things are coming. These are not bad, these are not harming us, so we can do that, is okay. One, then two, most important thing that we should have a frequent practice of hand hygiene, and that is the utmost important for every activities, and that is there. And third, the mask is compulsory. And fourth is to have a wholesome diet. Your diet should they have some immuno boosting diets, there's come up a lot of things. So don't be trapped of that, is not needed as
in fact. Let me just stop you there because we've got a caller online. Deepak is calling in from West Bengal. Deepak, please अपना सवाल पूछिए।
सर मेरा एक सवाल है सर। नमस्ते, जय हिंद। सर मैं ये पूछ रहा हूँ, मेरा सन उसका उम्र 14 इयर्स है। 14 इयर्स है, तो उसका एलर्जी का थोड़ा ज्यादा एलर्जी है, IgG 766। तो डॉक्टर दिखाया था, 2 महीने पहले उसका फीवर हुआ था, तो डॉक्टर ने एलर्जी का मेडिसिन तो दिया हुआ है, मॉन्टेयर 5 mg और एलेग्रा सिरप और 2 इनहेलर, 1 बुडिकॉट 100 mg 3 times, 1 puff 3 times एंड सेल्वियर आई 4 times। तो सर इस कोरोना वायरस स्प्रेडिंग के टाइम में ये जो इनहेलर है ये क्या कंटिन्यू कर सकते हैं हम?
डॉक्टर तालुकदार,
देखिए आपने जैसा बताया, इससे ऐसा प्रतीत होता है कि आपके बेटे को दमा है, एस्थमा है, जो एक किस्म की एलर्जिक बीमारी है। तो घबराने की कोई बात नहीं है। दवाई जो आपको दी गई है, एस्थमा का इलाज बेस्ट इनहेलर से होता है और इनहेलर लेने में कोई खतरा नहीं है। लेकिन एक बात मैं जरूर बताना चाहूंगा, ऐसे इनहेलर्स जो आपने नाम बताए हैं उसको लेने के बाद मुंह धोना, कुल्ला करना और मुंह को अच्छे से धोना जरूर रिकमेंडेड है। दूसरी चीज जो रिकमेंडेड है, आपके डॉक्टर साहब ने जरूर बताया होगा कि इनहेलर को एक स्पेसर नामक यंत्र से लिया जाए। तो अगर आप ये दोनों करेंगे तो आप आराम से, इनफैक्ट इस समय जरूरी है कि आप दवाइयां जो आपको बताया गया है वो ठीक से लेते रहें, क्योंकि एजमा के कुछ सिम्टम्स कोविड से मिलते जुलते हैं। इसीलिए बहुत जरूरी है कि आपके बेटे को एजमा के बताए हुए इलाज आप ठीक से लेते रहें। दूसरी चीज जरूर ध्यान रखें कि बाकी जो प्रिवेंशन मेजर्स हैं, सोशल डिस्टेंसिंग हो, हैंड हाइजीन हो, वो जरूर फॉलो करें। आपके घर में सिर्फ बेटा ही नहीं, घर के सभी सदस्य, सभी मेंबर्स घर के उस रूल को फॉलो करें और दवाई ठीक से लेते रहें और आराम से, कोई घबराने की बात नहीं, दमा आराम से कंट्रोल में रहता है।
Right. We've got a question on Twitter which says that why are bats so deadly? Why are bats so deadly? It's a carrier of COVID, along with few bats are carriers of rabies as well. My question is, why aren't dogs so deadly? So, I mean, why are bats so deadly, Dr. Biswas? Maybe, I mean, and also the bats seem to have an immunity to all these illnesses, and they are flying around and they've been around with us for so long. Why is it only now that we are getting all their illnesses?
देखिए, बैट्स जो है ये कैरियर, बहुत सारे वायरस कैरियर है, जैसे इबोला भी है, नेपा है, हाँ। तो ये जो सारे जो अब जो कोरोना है, दिस आर ऑल्सो दे आर द कैरियर्स, दे आर नॉट रियली सफरिंग फ्रॉम द डिजीज। तो मैकेनिज्म है बॉडी में, एक रिसेप्टर्स होते हैं, so this receptor mediated infection, inflammation होते हैं। तो these virus, they just a colonizer into their throat, so like that, you know, they are not really infected systematically. So when they come in contact with, you know, human, जैसे कि fruit bats होते हैं, जैसे नेपा में जो fruits they are eating, और saliva, bats के saliva उसमें लगे होते हैं, and if you eat that fruits,
so this is an important question that they talked about washing of vegetables. What about fruits? Fruits may have had, you know, they've been on trees where bats are.
Yeah, bats, if it is a half-eaten or fruit eaten by anything, we should not really eat that. So because we don't know whether this fruit is eaten by rats or bats, so both, all these animals, they can have the viruses in their mouth. So half-eaten or the partially eaten fruits, कभी भी जो भी fruits कभी लगता है किसी ने खाया है, तो उस फ्रूट्स को तो कभी नहीं खाना चाहिए। और फ्रूट्स को अगर नहीं खाया तो सलाइवा कांटेक्ट, एनिमल कांटेक्ट, वो हम नहीं मानते हैं। बट फ्रूट्स को तो हमेशा धो के खाना चाहिए, बिकॉज फंगस और बैक्टीरिया वो मोस्टली इंपॉर्टेंट है। वायरस मे बी समटाइम्स दे मे बी, बट दिस वल्नरेबल वायरस जो एनिमल जो ट्रांसफर फ्रॉम जीनोटिक टू द ह्यूमन, वो दिस आर द वेज इट कम्स, नो, आइदर मटन से, जैसे हम जो फ्लैश, जो भी मटन मार्केट से ये जो जहाँ पे स्प्रेड हुआ है, और फ्रूट्स से होता है, तो ये तो हमें थोड़ा सा केयरफुल होना होगा, जो कि ऐसे ह्यूमन में कभी कांटेक्ट में आए तो उसको ढंग से वेजिटेबल्स और फ्रूट्स ये वॉश करें।
Right. There's another question that I think you have already answered this. You know, you have said that take the influenza vaccine in the present condition as a precautionary measure. They've asked whether that's good to be done. Another question is, are pregnant women at more risk of the infection to corona? Which of you would like to answer?
Yeah.
Dr. Biswas,
yeah.
Pregnant women.
Pregnant women, definitely, pregnant women are having risk of many diseases. They are not in a really in a proper healthy state. So because this is a one kind of state where lot of infections, lot of anything can come up. और इससे सबसे बड़ी बात यह है कि जब इन्फेक्शन होता है तो सीवियरिटी होने का ज़्यादा चांसेस होती है इसमें। तो हमें हमेशा ऑलवेज प्रेग्नेंट लेडी को स्पेशल, नॉट ओनली फॉर द लेडी बट वी हैव टू टेक केयर ऑफ द बेबी ऑल्सो। So it has been seen, just also reported, if the mother infected, so mother to child infection also seen that transmission through mother to child, it has been seen, and very young also the mother infected, तो बच्चों को भी हुआ है। तो हमें इसमें ध्यान देना होगा। सिम्टोमेटिक है तो डेफिनेटली इसके तो वी डोंट हैव एनी मेडिसिन, कोविड का कोई स्पेसिफिक मेडिसिन नहीं है, कोई ट्रीटमेंट नहीं है, ओनली सिम्टोमेटिक ट्रीटमेंट है। जब लगे कि कोई सिम्टम्स है तो इमीडिएटली कोविड तो पहले एक्सक्लूड करना चाहिए, टेस्टिंग करना चाहिए, और अगर कोविड नहीं है तो उस हिसाब से और भी कुछ सिम्टम्स है देखना चाहिए। बट वी हैव टू टेक very strong precaution for the pregnant lady.
Dr. Talukdar, kindly let me know, if most of the corona patients come out completely cured, then why are we so worried about this virus? It has such a high percentage of curing. Is it contagion? I mean, the fact that it's easily transmitted, is it such a matter of big concern if most people get cured?
Yes, your question has the answer hidden in it. See, the good part is of us would not even get to know that we have coronavirus, because the symptoms would be so mild, right? So that is the best part of this disease. Hardly 15 or 14% of us may require admission, and 4 to 5% have to go into critical care. So you have a point there that yes, the disease, most of us do not have major issues. But the problem is, this is a very infectious disease. It's easily spreads from one person to another. And just see the size of the country, 1.3 billion people. So even if it involves 5% of us going into critical care, if we are not careful and the disease spreads very quickly, then there will be such a surge of patients if we are not very careful. So how would the health system be able to take care of them? That's why it is imperative that we, what we call, flatten the curve. All this step is towards flattening this curve so that the chain of transmission is halted, broken, or at least retarded to some extent. This is all. This is how we all are progressing in this graded response. So yes, you are right. Most of us won't have problems, but yet, in order to spread this infection, prevent the spread of this infection, all these steps are imperative.
Dr. Kumar, would you like to add to this?
So basically, it is a interesting point that you have to see the number and the content. What we see, the disease is a disease per se. If I have diabetes, you have a heart problem, it is limited to group of persons. But it is something public health. This is disease which is not bad to any particular person. So when you consider that it affects the 1% of the Indian population, it becomes 1.3 CR. You just imagine 1.3 CR getting infected at a single point of time. Even 80% goes out recovered also. We have another 25 lakhs patients has been suffered. So that is why we have not panicked. I am telling you, doctors are not panicked also, and you should not be panicked also. But it is the volume of the patient, the burden on the healthcare, that will make us something to worry for. So that's why preparedness is required. But you remember that if you are not coming to the high risk category and you have mild symptoms, is curable completely even at the home without medications. So it's nothing to a major thing to be worried for.
Right, Dr. Biswas, we leave the final words to you because we run short of time. So what would you give, what advice would you give people? I mean, we all are getting used to the lockdown now. People are understanding the importance of, containing the spread of this virus. But also, many other questions have been raised today. Some of the important questions are like, even after we have managed to get back to a situation of zero, like maybe Singapore got, then, we start life normal, then would we have to restart this whole process? So there are these kind of lingering problems.
Yeah, just if you look at the US, UK and other developed country, it is a very scary situation. The US, they had the death, 2,400 deaths per day. So you can imagine what is serious threat in those countries. And compared to that, we are in a safe zone. We have started our lockdown in a very early stage, and still we are doing far better compared to this country. If you look at this Western and the American countries, they are developed. Everything is, the system is very at place. But we Indian, but here the question is, we are having densely populated 1.3 billion people are living. So as we understand the transmissibility of this disease, infectious, the transmissibility, the dynamic transmission is very high. So that we have understood from Wuhan to till now, whole earth is affected by and burning by due to the corona. So India is already affected. But from the beginning, we are doing well, and ultimate only एकमात्र उपाय इस बीमारी से बचने के लिए is the lockdown. Now lockdown में क्या क्या करना है, ऑलरेडी हम देख चुके हैं, जो सोशल डिस्टेंसिंग करना है, हैंड वॉशिंग करना है, मास्क मैंडेटरी हो गया है. तो ये जो सारे पद्धति है, ये हमें जरूर बरतनी होगी और strictly we have to follow. But still there are many people coming out. As I have said, that there are 14,000 people still detected during this 2 to 3 weeks. So this we have to be very careful. This should not happen during this time, and we strictly follow this, and we are still in safe zone. We need not to panic, and you follow this lockdown I think all rules, regulations strictly, and then we'll be free from this coronaviral affected disease.
Thank you very much, Professor Ashutosh Biswas, Dr. Tanmay Talukdar, and Dr. Ashok Kumar for joining us and helping our viewers understand whatever has really troubled them. And I'm sorry that our lines were a little non-functional today, but we shall get them repaired. But many of you have sent us lots of questions on Twitter, and we thank you for that. Do continue to send us your questions through email, Twitter, Facebook, and of course do call in the live program as well. The program is between 2 and 3. And as our doctors have said, so the lockdown has a very definite purpose, and the results are definitely there for all of us to see. All of us are participants in it, and we request us to consolidate on our advantages and, you know, maintain this, sustain this good behavior in a sense for a longer period of time, because that's the only way we can actually all triumph from this in this fight against COVID-19. Thanks for being with us. Namaskar.